Preventing injuries in sport and exercise. The sports medicine professional is concerned with the well-being of the athlete and generally assumes the responsibility for overseeing the total health care for the athlete. Participation in sports places the athlete in a situation in which injury is likely to occur. Fortunately, most injuries are not serious and lend themselves to rapid rehabilitation. But the sports medicine professional must be capable of dealing with any type of trauma or catastrophic injury. We've spent a lot of time this semester recognizing injuries and learning when they require further intervention or referral for advanced care versus conservative treatment. This lecture will focus on a different aspect of kinesiology, including athletic training and strength and conditioning, with the focus aimed on preventative injuries in sport and exercise. Prior to participation, the general goal of a PPE or pre-participation physical examination are to determine the general physical and psychological health of the athlete. We want to evaluate for life-threatening or disabling conditions, including the risk of sudden cardiac arrest or other conditions that may predispose an athlete to illness or injury. This serves as an entry point into the healthcare system for those without medical home or a primary care physician. The pre-participation physical examination should include a structured physical examination that focuses on the cardiovascular, musculoskeletal, and neurological systems. Screening for depression, anxiety disorders, and attention deficit or hyperactive disorder is also recommended. Clinicians should recognize any findings suggestive of the relative energy deficiency in sports syndrome. Additional considerations is required to address the needs and considerations of transgendered athletes and athletes with physical and intellectual disabilities. Guidelines have been published regarding return to play for athletes who have had COVID-19 that must be followed. Another aspect to consider prior to participation is acclimatization. Acclimatization is the process in which an individual adjusts to the change in its environment, such as a change in altitude, temperature, humidity, photoperiod, or pH, and allowing to maintain fitness across a range of environmental conditions. Acclimatization occurs in a short period of time, either hours to weeks, and within an organism's lifetime, compared to adaptation, which is an evolution taking place over many generations, that is necessary prior to outdoor participation. This occurs when biological adaptations that reduce the physiological strain, such as heart rate and body temperature, and improve comfort, improved exercise capacity, and a reduction in the risk of serious heat illness that can occur with exposure to heat stresses. This is a biological adaptation that includes the integrated thermoregulatory, cardiovascular, fluid electrolyte, metabolic, and molecular responses. Heat acclimatization occurs when repeated exercise heat exposures are sufficiently stressful to invoke profuse sweating and elevate whole body temperatures. This generally occurs in about 1 to 2 weeks of 90-minute daily heat exposures. But highly aerobic fit athletes may be able to acclimatize to heat quicker. Heat acclimatization is specific to the climatic heat stress, desert or tropic, and physical exercise intensities that the athlete is exposed to, which should simulate the expected competitive environment. Heat acclimation or acclimatization plays a large part in the body's physical responses and overall ability to cope with heat exposure. Heat acclimation is a broad term that can be loosely defined as a complex series of changes or adaptations that occur in response to heat stresses in a controlled environment over the course of 7 to 14 days. These adaptations are beneficial to exercise in the heat and allow the body to better cope with heat stress. Heat acclimatization describes the same process but happens in a natural environment. In either case, the positive adaptations that occur include reductions in heart rate, internal body temperature response, skin temperature response, sweat electrolyte concentrations, and rating of perceived exertion, as well as increases in sweat rate, sweat onset or the sweating starting earlier, blood flow, and exercise performance in the heat and cooler conditions. All of these changes improve an athlete's ability to handle heat stress during exercise. It is also important to note that factors affecting these changes determine the extent to which adaptation occurs. For example, acclimatization in hot and dry environments has been shown to be different from that in hot and humid environments. A greater sweat rate increase has been seen in the later cases. Acclimation is also known to be dependent upon the volume of exercise, intensity, duration, and maintenance of an elevated internal body temperature during exercise. When preparing to acclimatize to the heat, athletes should gain a base level of fitness in a cooler environment prior to heat exposure. Fit individuals already have some of the physical advantages that are gained with acclimatization, for example, an increased sweat rate. Guidelines have been introduced for the high school population for the purpose of gradual heat acclimatization during a preseason. Some heat acclimatization tips include: do not participate in more than one practice per day in the first 5 days of practice. Do not practice more than 3 hours in one day for the first 5 days of practice. Do not wear full gear until day 6 of practice. For full day contact sports, live full contact drills should not be used until day 6 of practice. For double day practices, they must be allowed to follow a single practice day or a day of rest. On double practice days, each practice should not exceed 3 hours, including stretching, warm-up, cool-down, and lifting. Do not participate in more than 5 hours of practice total for double day practice days, from day 6 through 14. Be properly hydrated before, during, and after practice. Gradually increase the intensity of practice over the course of a few days. Increase the amount of sodium in the diet for the first few days of practice to make up for sweat salt loss. Avoid practicing while sick. Have cooling methods available during practice, such as ice towels and ice tubs for cold water immersion. Take breaks frequently to avoid your body overheating, and get plenty of sleep the night before practices. Make sure to monitor for signs of exertional heat stroke, heat exhaustion, and heat syncope during the initial days of acclimatization. Additional things prior to participation: strength and fitness assessments. Strength and fitness assessments measure the maximal amount of force a muscle group can exert at one time. Examples of exercises used in strength testing include push-up tests and core strength and stability tests. Other basic fitness tests may include flexibility tests, such as a sit and reach test, endurance tests, such as the Cooper test, upper body strength tests, such as a push-up test, core strength tests, such as a plank test, target heart rate tests, or body size calculation tests, such as weight or body mass index testing. Preseason conditioning. Preseason conditioning is training that occurs in the time frame directly before the actual sports season starts. This typically involves the cardiovascular activities, weight training, and sport-related drills. Preseason training strengthens the fitness foundations and helps to renew and enhance technical abilities in a chosen sport. Training theory is not useful unless it can be applied to the real world of training. This figure shows how training loads are applied in a systematic fashion to take advantage of the general adaptation syndrome and systematically improve athletic performance. The principle of progression is important when prescribing training loads throughout a program to ensure proper and desired adaptations. The field of strength training and conditioning is driven by research-based information that allows for the proper utilization of sets, repetitions, volume, and rest periods to elicit a desired physiological adaptation. The information surrounding these topics has been discussed for many years. Professional organizations have guidelines and recommendations associated with these variables that allow for strength training and conditioning coaches to target specific adaptations for physiological systems based on the guidelines provided. It is imperative that strength training and conditioning coaches understand these guidelines and the application of these guidelines to induce the desired adaptations for the athletes with whom they work. These guidelines and recommendations not only promote certain training adaptations, but also decrease the likelihood of injuries during training. Direct access to these guidelines and recommendations should be available to strength and conditioning coaches at any facility. Access to this information will not only decrease the chance of injuries due to improper programming, but can also provide corrective prescription to targeted physiological variables progressively during the course of a training macro cycle. A macro cycle refers to the training that occurs over the course of an entire season. Macro cycles are further broken down into microcycles that sometimes are referred to as parts of the season. This is commonly the preseason, in-season, and postseason. There may even be smaller cycles that are broken down into weekly or even daily cycles that can be smaller in nature. These are all developed by strength and conditioning professionals. Some of you may be interested in pursuing a degree in strength and conditioning. We're lucky here we have a program in strength and conditioning that is CASCI accredited, the Council on Accreditation of Strength and Conditioning Education. Both of our programs at the undergrad and grad level are accredited. After 2030, students will need to graduate from an accredited program to sit for the NSCA National Strength and Conditioning Association Certified Strength and Conditioning Specialization CSCS National Certification Examination. If this is an area that you think you might want to pursue, please come and talk to one of your faculty members about academic advising so that we can give you additional information. This is an area of exploding growth. This is the performance pyramid. Many of our aspects of kinesiology are included in here. Kinesiology is a broad term for just movement. Biomechanics includes movement fundamentals and the analysis of those movements. Strength and conditioning includes different types of performance and figuring out how to make people stronger, faster, and better. Exercise technique and skill performances can be housed above that, and then program design and training principles are included in that. All of these different aspects work together. So many of you have identified different areas of kinesiology in which you would like to work in your future. Don't forget, many of your classmates are going to work in other areas of kinesiology, but we all still work within this pyramid, often with the same patients or clients, to help them perform at their peak. It is a group effort, often not a siloed effort at all.